Hi there! Good day, everyone! Today, we will talk about two topics. First is about interpersonal theory, and the other one is about interpersonal psychotherapy model. What is interpersonal theory? Interpersonal theory was developed by Harry Stack Sullivan. This is his picture. He is the father of modern psychiatry and he worked with the mentally ill patients, particularly schizophrenics, employing a method he early on labeled interpersonal therapy. He created a new viewpoint which is known today as the interpersonal theory of psychiatry. Interpersonal theory emphasizes the importance of various developmental stages such as infancy, childhood, juvenile era, pre-adolescence, early adolescence, late adolescence, and adulthood.
First, let's discuss the stages of development in interpersonal theory. The first stage is infancy from birth to 18 months. In this stage, Sullivan believes that relief from anxiety of infants can be achieved through oral gratification of needs provided by a mother. Sullivan also claims that an infant becomes human through tenderness received from the mothering one. The second stage is childhood from 18 to 6 years. Sullivan referred this stage as a period of rapid acculturation, since besides from acquiring language, children learn cultural patterns and begin to form relationships with their parents or significant others, including imaginary playmates. The third stage is juvenile era from 6 to 9 years. The juvenile era begins with the appearance of need for peers or playmates of equal status and ends when one finds a single chum to satisfy the need for intimacy. Sullivan believed that a child should learn to compete, compromise, and cooperate with other children in this stage. The fourth stage is pre-adolescence from 9 to 12 years. In this stage, people learn to form satisfactory relationships with persons of the same gender and initiation of feelings of affection and respect for another person. The outstanding characteristic of pre-adolescence is the genesis of the capacity to love. During pre-adolescence, intimacy and love become the essence of friendship. The fifth stage is early adolescence from 12 to 14 years. Early adolescence begins with puberty and ends with the need for sexual love with one person. This stage is marked by the eruption of genital interest and the advent of lustful relationships. Sullivan believed that early adolescence is the turning point in personality development. The sixth stage is late adolescence from 14 to 21 years, and in this stage, people start to establish self-identity, experiencing satisfying relationships and working to develop a lasting, intimate opposite-gender relationship. Late adolescence embraces that period of self-discovery when adolescents are determining their preferences in genital behavior. The fusion of intimacy and lust begins in this stage. For the last stage, we have adulthood from 21 to 60 years. People in this stage have reached the level of maturity and high intimacy and focuses on the completion of personality. Sullivan stated that this really highly developed intimacy with another is not the principal business of life, but is perhaps the principal source of satisfaction in life.
For clinical application, Sullivan's model suggests that communicating with other people may have an effect on people's thoughts, sense of self, and sense of security. This nursing model is the foundation for interpersonal psychotherapy, which is used to treat patients with depression and schizophrenia. It aids in the treatment of patients suffering from depression, which most frequently arises as a result of traumatic events such as loss. In his model, it explained the role of interpersonal relationship and experiences in one's journey through shaping their own personality. Each patient's behavior serves a purpose in avoiding anxiety and to also meet their needs and shaping their personality. We have here a clinical scenario. Miss Andrea, a 29-year-old female, expressed her inability to get close to people. She clarified that she grew up in a stable home with a caring and perfect family. Her family is a devout Christian, so the majority of her practices are strictly religious. She had a significant number of friends and had a close boyfriend in her early adolescence. She believes Her fear of closeness started when a friend began to fondle her in a sexually provocative manner. She didn't tell anyone because she was terrified and felt guilty. Since then, she has isolated herself from others, has never dated, and has never attempted to open up to someone else.
Miss Andrea's experience during her early adolescent stage has greatly influenced her present situation. A negative event in this stage has molded her personality into a conservative and fearful person. Sullivan's theory will assist you in comprehending your client as well as helping her in her recovery. You see that your client was unable to meet her friendship and love needs. Her anxiety that if her parents found out, her parents will abandon her. As a result, this theory can extremely be helpful in recognizing and bolstering your patient's strengths, concerns, and low self-esteem. This will allow you to support your clients by helping them to consider their feelings in light of their past experiences, while still accepting that the past is over and out of their control. As a result, she should first be able to participate in and experience non-sexual intimacy.
Now let us discuss about interpersonal psychotherapy model. Interpersonal psychotherapy model was initially developed as a brief therapy for depression. IPT was developed by Gerald Clermont and Myrna Weissman in the 1970s and based on the work of Harry Stack Sullivan, Adolf Meyer, and John Bowlby.
In general, interpersonal therapists provide active, non-judgmental treatment in order to help people in therapy successfully handle challenges and improve mental health. IPT is well researched as an effective treatment for depression and has been modified to treat several other mental health issues. These include anxiety, disordered eating, dyspnea, substance abuse issues, bipolar, postpartum depression, social phobia, and post-traumatic stress. Now let us tackle the interpersonal psychotherapy processes. IPT is a form of therapy. It lends itself to modifications that make it suitable for the treatment of several mental health concerns. In addition, IPT can be conducted individually or in a group setting with children, adolescents, and adults.
The interpersonal process has three goals. First is to establish a significant emotional relationship between counselor and client. Second, the counselor must be able to respond effectively to the client's emotions and inner life. Third is conceptualization of the client's personality and problems to determine what experiences the client needs in therapeutic relationship to change. According to Markowitz, Svartberg, and Swartz in 1998, IPT is characterized by 7 key features.
1. Time limited with phases. Firstly, IPT is time limited, usually spanning 12 to 16 weeks. This feature of the therapy is always discussed with the patient at the outset of treatment, and its purpose is to place pressure on the patient to achieve the agreed upon goals of the therapy swiftly. Phase 1 usually lasts 1 to 4 weeks. Goals. The therapist identifies the target diagnosis and the interpersonal context it relates to. This is sometimes referred to as the assessment phase. In this phase, the therapist gets consent from the patient to proceed with IPT and conducts an interpersonal inventory. Phase 2 lasts about 5 to 12 weeks. The patient and therapist discuss recent experiences that relate to the interpersonal area being developed. Discussions are intentionally grounded in recent occurrences and everyday interactions. The therapist provides practical tools and positive strategies to help the client manage these interactions more effectively. Phase 3 lasts about 13 to 16 weeks. The therapist provides strategies for the client to manage their interpersonal relationships following termination of the therapy. Sometimes, there will also be monthly follow-ups following this acute 16-week treatment phase. 2. Applies a medical model. A second key feature of IPT is that the patient's presenting problem is explicitly defined as a medical illness. This framing creates distance between the patient's suffering and their sense of self, allowing the patient to recognize that their current experiences are not a feature of their character but a consequence of their current circumstances and illness.
The third key feature is goals. IPT is characterized by the dual aims of resolving an interpersonal issue and relieving the symptoms of a mood disorder. The therapist explicitly links these two goals in the assessment phase of treatment to identify the focus of treatment, which will fall into one of the four problem areas. The first one is grief or complicated bereavement. It is chosen as the problem area when the death of someone close to the patient is the cause of a mood disturbance. The second is role dispute. This is a chosen problem area when dissatisfaction with the role expectations between the patient and someone in their life is the cause of a mood disturbance. The third one is role transition. This problem is chosen when mood disturbance is brought on by major life transitions. Difficulty coping with the transition can be observed in domains such as employment, close relationships, physical health, living conditions, and more. The last one is interpersonal deficits. This problem is chosen when no single event or relationship is driving a mood disturbance. Rather, the patient has experienced difficulty in interpersonal relationships and functioning across a range of contexts throughout time. The fourth key feature is here and now interpersonal focus. IPT focuses treatment around interpersonal events in the patient's current life. It is for this reason that IPT is often referred to as a here and now focus. The fifth key feature is specific IPT techniques. IPT uses a range of innovative techniques for engaging with clients to bring about relief from mood disturbances and encourage behavior change. They will then apply techniques predominantly from psychodynamic practice to invite the client to explore alternative means to handle the problem and help them identify new, adaptive behaviors for managing similar scenarios in the future. Such techniques include role-playing and communication analysis. The sixth key feature is termination. The final phase of IPT involves the lead-up to termination of the therapeutic relationship using a relapse prevention framework. In this phase, the therapist will encourage the patient to explore their feelings and reactions to the termination. This phase in the time-bound nature of IPT overall is critical as it is often following the course of IPT that the real benefits of the therapy become apparent. It is often only upon termination of the treatment that a patient realizes they can completely manage their interpersonal affairs by applying the skills they have learned and without ongoing therapeutic support. The last key feature is therapeutic stance. Many forms of therapy require the therapist to operate from a position of neutrality. In contrast, the IPT therapist adopts the role of an openly supportive and optimistic ally, a little like a cheerleader. This optimistic outlook can be critical to counter the negative outlook often presented by depressed patients. This is where we end our discussion, and we hope that you learned something from our presentation. Thank you very much for watching and listening. Have a good day.